Mastectomy scar treatment. This is a research paper review. My name's Denise Stewart. I'm an occupational therapist, and the paper is ASTIN Therapy Improves Function and Range of Motion Following Mastectomy. The authors are Claire Davies, Dorothy Brockhoff, and Christina Moe. This paper focuses on active scar tissue after breast cancer. The scar tissue can be hypersensitive and make wearing tight clothing painful or uncomfortable, and can result in limiting the recovery of arm movement and strength. The authors write, scar tissue often goes untreated and becomes painful and hypersensitive. Restrictions in tissue flexibility reduce movement at the shoulder, affecting function. Studies have demonstrated that up to 86% of breast cancer survivors have a shoulder limitation following complete axillary dissection, and 45% have limitations after a sentinel node biopsy. Let's talk about the study group. They came from the Baptist Health Rehab from Kentucky, USA. 40 women following mastectomy were referred to therapy because of pain or movement difficulties. The participants varied in length of time from mastectomy surgery, and the average was 7 months since surgery. The volunteers completed 4 tests before and after the physiotherapy treatment program. A clothing questionnaire was developed by the authors and included items such as how painful or difficult is wearing a bra, how long can the bra be worn, and is touching the mastectomy area a problem. The DASH, which is a disabilities of arm, shoulder and hand scale, was used to rate 30 tasks that are commonly used in the day, and the women are asked to rate those tasks on difficulty, which 1 is no difficulty, up to 5, which is unable. A total score is calculated, and the range goes from 0%, which is no problems, to 100%, which is severe disability. The patient-specific functional scale allows the woman to select 5 tasks where they can use a rating from 0, not able to perform an activity, to 10, where they are able to perform the activity at the same level. Shoulder movement is recorded as the maximum movement when raising the arm to the ear, lifting the arm to the front and to the side. So the treatment program involved 6 to 8 sessions, 2 sessions a week, and over a period of 4 to 6 weeks. The treatment session involved lymphatic massage of the chest before and after the treatment if it was required. The ASTIN tool was used over the chest, arm stretches, and then a home program of arm stretches was expected. So the ASTIN tool is a handheld device that helps a therapist to stretch the skin and the tissues below. Gentle gliding strokes are applied over the chest skin, chest muscle, the mastectomy scar tissue, and drain scar tissue if it's present. The pressure applied with the ASTIN tool was adjusted for each person to manage the level of discomfort and the degree and direction of scar and adhesion. The results looked at the improvement of the group, and so a group average or the group mean. So there was an improvement of 10 points on the DASH, an improvement of 2 points on the patient-specific functional scale, and positive change in the clothing scale of 4 points. Shoulder movement improvements, again recorded as the group mean, was an improvement of 17.5 degrees in arm to ear, raising to the front, 19.38 degrees when the arm was raised out to the side towards the ear. It is worth noting that full movement in both planes was not achieved by all participants at the end of the 4 to 6 week treatment program. The patients who were not included in this study, and if you look at the red writing, so patients with infections, active cancer, implants, lymphedema greater than stage 1, and open wounds were not included in this study. and that patients were an average of 7 months after surgery. So the first conclusion is that A-stim over certain mastectomy scars and arm stretches can help in regaining movement. The second conclusion is that sensitivity of the chest wall to pressure, such as wearing a bra, can improve with this type of treatment program. Thirdly, positive changes in performing general tasks and specific tasks as selected by the participant can occur following this type of program. Also, that positive changes can occur many months after surgery. So the program evaluated in this research was 6 to 8 treatments over a 4 to 6 week period using a combination of treatments including the A-stim tool. So the therapists who perform these treatments are highly skilled in breast cancer rehabilitation, and this technique needs to be applied by a therapist who is skilled in skin, scar and lymphedema impairments associated with post-breast cancer. So there are several questions that we can ask after this research, and that is, when is the best time to treat mastectomy scar, either early or later? How many A-stim treatments and over what time frame does it take to achieve full range of movement of the shoulder? And how does A-stim compare to other scar release techniques? My takeaways from this research: this is the first time that mastectomy scar treatment other than exercise and stretch has been studied using a large number of participants. Previous research has really involved single case studies only. My next takeaway is that using these rating scales can help women communicate a clear message to healthcare professionals about the severity and impact of mastectomy scar. These rating scales can be downloaded from my website. My final takeaway is that treatments other than exercise need to be available to women who experience difficulty after mastectomy. My recommendation is, if you have chest sensitivity, arm movement problems, or do not have arm strength suitable to do the day-to-day jobs easily, then speak to your breast cancer care team. Ask about their method of reviewing your progress in physical recovery after surgery and radiotherapy, and finally, ask for a referral to a breast cancer rehabilitation therapist.